Everything in the world is about sex, except sex. Sex is about power. Who have given me the chance to speak to this august audience. I'm really indebted to many luminaries in this hall, Dr. Raj Brahmbhatt, Dr. T.S. Rao, and many other seniors who are the mentors, because I'm a newborn in this particular field and they are nurturing me. So I'm learning sex and sexual medicine through them. Sex is like air. It is not important unless you are not getting any. अपन सांस लेते हैं, जब सांस रुक जाती है तब मालूम पड़ता है कि हवा कितनी जरूरी है. Everything in the world is about sex, except sex. Sex is about power. My topic is Peyronie's disease. Dr. Pradhan, अभी उन्होंने बताया छोटा बड़ा, यहाँ तो पूरा तिरछा ही हो जाता है. So direction is very important along with the size. This is my hospital where I work. Peyronie's disease is a connective tissue disorder of the penis that can be likened to deferens contracture of the hand. It is characterized by a triad of bent erection, pain in the penis with erections, and palpable penile plaque. Peyronie's disease is quite common, affecting as many as 1 in 11 men despite the lack of public awareness. The penis is composed of the same connective tissue as every other joint in the body. That's why it becomes hardened when it gets erect. The anatomy of the penis is composed of 3 cylinders, the paired erectile bodies and the urethra. The erectile bodies, corpora cavernosa, are made up of sinusoidal tissue that fills up with blood during an erection, and outer covering tunica albuginea, which is composed of tough fibroelastic tissue. The outer covering determines the size and shape of the erection. So you all know the anatomy, and in this particular disease, there is a thick plaque which bends the penis due to fibrosis. The principal finding in men with Peyronie's disease is the deposition of scar tissue in the tunica albuginea. All of the clinical symptoms are derived from this event. The curvature of the penis is due to the fact that scar tissue does not stretch as well as the normal tissue. The normal tunica albuginea is composed of elastin fibers and collagen. The site of scar tissue forms from Peyronie's disease is composed mostly of collagen that can harden to the thickness of bone. Although most men with Peyronie's disease report that their penis is bent upwards, a variety of other abnormalities are frequently observed, including bends in other directions, complex bends, divots in the side of the penis, and hourglass deformity. The palpable plaque is actual scar tissue that has deposited on the outer covering of the erectile bodies. This is present in the vast majority, but not all patients with Peyronie's disease. The plaque may become calcified like bone with severe disease. Finally, the pain experienced with erections is thought to be due to active inflammation in the plaque and usually disappears on its own with time. Normally, the pain in the Peyronie's disease occurs when there is inflammation. Once the inflammation subsides, there is no pain. And this is a long period when the inflammation subsides, which is about 12 months. Erectile function may be adversely affected by Peyronie's disease. It is unclear whether erectile dysfunction causes Peyronie's disease or vice versa. It is probably a little of both. While most patients with Peyronie's disease report normal penile rigidity during erection, some have trouble maintaining erections due to leaky veins in the penis, a process called veno-occlusive disease of the penis. So here, there is nothing wrong with the corpora cavernosa. The filling of the blood is there, but due to the leaky veins, which normally shut off during erections, there may be flaccidity of the penis. The disease process of Peyronie's disease does not normally affect the sinusoidal tissue within the erectile bodies, but it can affect the veins exiting the erectile bodies and prevent their proper closure. The main sexual complaints, despite the physical deformity, is the bend itself, preventing vaginal intromission or causing pain to the partner. The exact etiology of Peyronie's disease is unknown. There is evidence that it may have a genetic basis. A positive family history is common but not typical. There is an association with other connective tissue disorder, specifically diphtherians contracture affecting the palm of the hands. The most popular theory today is that Peyronie's disease is induced by trauma. The trauma may be acute and distinct, such as penile fracture, but more often it is chronic and low-grade, such as repeated attempts at sexual intercourse with weak or incomplete erections. The natural history of Peyronie's disease is unique in that spontaneous resolution is not uncommon. In general, the disease course is one of sudden onset, progression, and then stabilization. Whether or not it is getting better or worse, the deformity may resolve spontaneously if it has not been stable for more than 6 months. When a patient presents with active disease, the chance of spontaneous improvement is approximately 20%, the chance of stabilization is 40%, and the chance of further progression is 40%. So there is a lot of gray area in this particular disease, and the course of the disease is very long, and there is total resolution of the disease. That's why the development of the medical science was unable to bring out the real cause and the real treatment for this particular problem. The management of Peyronie's disease is dependent upon the extent of stabilization of the disease state, the severity of the penile defect, and erectile function. Medical therapy has been ineffective. With the exception of anti-inflammatory agents, medical therapy is no longer recommended by the American Urological Association. Surgical therapy is employed when there is a significant penile defect preventing sexual relation. Mind well, in not every patient, only those who are debilitated and could not perform sexual intercourse, this treatment is offered. Patient with concomitant erectile dysfunction should undergo therapy for the erectile dysfunction first. Patient with bent erections who have been stable for more than 6 months and prevent sex undergo penile straightening surgery. This is an outpatient procedure with a recovery time of less than 1 week. The exact method of straightening the penis is determined by the site and severity of the curvature as well as the penile anatomy assessed by penile ultrasonography. Lockup में रखते हैं इसको, penis को, and this is the constant stretching by which the penis, to some extent, it becomes straightened. Surgical management. A number of surgical techniques are used for treatment of Peyronie's disease. The technique should be individually chosen for each patient. Optimal surgical approach considers 4 things: penile rigidity, degree of curvature, shaft narrowing, erectile response. Nesbitt procedure is one commonly used surgical technique. It involves excision of the plaque accompanied by page grafting of the defect left by the excision. Graft material is generally taken from the scrotal tunica vaginalis or non-hair-bearing area, the skin of the forearm. Artificial graft material are also available, that is Gore-Tex. These materials are generally less elastic and do not permit adequate stretch of the corpora during erections. So this is the procedure, whole procedure. The plaque which was in the center of the penis was excised up to the tunica albuginea, and the graft was then put, care being taken not to injure the nerve tissue, which is playing a great role in the erection of the penis. Excision of the plaque has been associated with complaints of diminished rigidity of erection and impotence following surgery. These problems have been attributed to damage of the erectile nerves during penile surgery. Thus, it is sometimes more practical to treat severe cases of Peyronie's disease with placement of an artificial penile prosthesis following incision and release of the plaque. The potential complication of penile straightening surgery are palpable suture knots, penile shortening, approximately 1 centimeter for every 15-degree correction, numbness of the penis, residual curvature, and worsening erectile dysfunction. With the exception of the penile shortening, which is not perceptible in most men, they are all rare. As an alternative to surgery for men with normal erectile function, some men are undergoing penile traction therapy in the active and chronic phases. However, traction therapy requires a time commitment of at least 3 hours a day and is still investigational. For the patient with significant deformity greater than 90 degrees, and erection loss not responsive to medical therapy, penile prosthesis surgery is standardly recommended. This indication falls under the various categories by which penile prosthesis surgery is indicated and can be offered with great success. There are 2 types of implant. Inflatable implants, inflatable devices, the most common type of penile implant, can be inflated to create an erection and deflated at other times. 3-piece inflatable implants use a fluid-filled reservoir implanted under the abdominal wall, a pump and a release valve placed inside the scrotum, and 2 inflatable cylinders inside the penis. This is the picture which shows the reservoir of the fluid, which is normal saline, inside the abdominal wall, and the pump inside the scrotum, and this is the inflatable implant inside the corpora. To achieve an erection, you pump the fluid, which is saline, from the reservoir into the cylinder. Afterward, you release the valve inside the scrotum to drain the fluid back into the reservoir. The 2-piece model works in a similar way, but the fluid reservoir is part of the pump implanted in the scrotum. Here, both the things, pump and the reservoir, they are implanted in the scrotum. In both the devices, the reservoir is filled with saline the day of surgery and remains in the device. Another option is semi-rigid rods. Semi-rigid devices are always firm. The penis can be bent away from the body for sexual activity and towards the body for concealment. A positional penile implant is a semi-rigid device with a central series of segments held together with a spring on each end. It can maintain upward and downward positions better than the other semi-rigid rods can. This is the picture of the semi-rigid rod. The results. Although penile implants are the most invasive treatment for erectile dysfunction, most men who have them and their partners report satisfaction with the devices. In fact, penile implants have the highest rate of satisfaction of all the erectile dysfunction treatments. Now, the key points about Peyronie's disease. Peyronie's disease causes hard, flat plaque to form beneath the skin on the tissue of the penis. It causes pain and a sharp curve in the penis during erections. Some researchers believe Peyronie's disease develops after injury that causes bleeding inside the penis. but most cases develop slowly after no clear injury. Peyronie's disease causes changes in the way an erection looks, pain when the penis is erect, and trouble with sexual penetration. A physical examination during which the plaque can often be felt may be all that is needed to diagnose Peyronie's disease. The goal of treatment is to reduce pain and maintain sexual activity. In some cases, treatment is not needed. Peyronie's disease often happens in a mild form that heals on its own in 6 to 15 months. So there should not be any haste to offer surgical treatment. There is no cure for Peyronie's disease. A wide variety of medicines may be tried. Most are taken by mouth, but some are injected into the plaque. In severe cases, surgery may be used to remove the plaque. Thank you very much. Any question?
Sir, there is any non-surgical method you will suggest for Peyronie disease? Non-surgical treatment of Peyronie disease, you may suggest some.
The literature doesn't suggest, because everything has been tried for Peyronie's disease. But it is a slowly progressing disease, and anything, because in our medical science, we go for double-blind trials. And in chronicity of the disease, it is very difficult to assess the double-blind trial and the trials done at 2 different centers. Secondly, most of the, I have seen only single case of Peyronie's disease in my lifetime, and my practice is of 40 years. Because of shame or what, I don't know, they don't come to us. So it is very difficult to.
I'm Dr. Ritesh, I'm a urologist. Am I audible?
Boliye.
I'm Dr. Ritesh, I'm a urologist. We often see Peyronie's disease. First, as regards medical management, in the acute phase, we need to give drugs which are anti-inflammatory. Many have been used. Colchicine is one. Vitamin E is the other.
I have described.
Yeah, and they're being used in combination. They reduce the pain a lot. Then another thing which he asked, any non-surgical treatment, intralesional verapamil has been used, 10 milligram in 10 ml. I think we give around every 2 weeks around 12 injections. It has been working very well. And the last is phenyl implant.
Oh, hyaluronidase has been injected, but all said and done, they are saying that the disease itself, it resolves in 40% of the cases in a long course, that is about 12 months. So we don't know whether this anti-inflammatory or the injectable treatment has done it, or naturally it is regressing.
But
you are getting my point.
In the painful phase, patients do ask for treatment, and patients who are on treatment
we can give, but scientific literature doesn't support, and they categorically say that medical treatment per se is not very beneficial. And ultimately, if the disease is severe and it is incapacitating the sexual life of the person, the ultimate thing is surgery.
And just one more thing, last I would like to add, the grafts you talked about. The most recommended graft is the porcine or the pericardial graft. They come specifically, now most of us have left Goretics. So porcine pericardial graft is now
that is better.
In India. Now we are using
that is better and very well accepted by the body.
Yeah, a bit costly, but that's the best now. Thank you.
I am getting Peyronie's patient very commonly. Important thing is etiology part. The mainly diabetic patients having more and more chances of Peyronie's disease. So this is important to whom you are going to treat. In case of diabetic, if you go for surgery, once you will cure one plaque, there will be another plaque very soon. So in diabetic patient, there is no use of surgery, first thing. Second, if most of the cases, when the patient finds the plaque, it's already too late. So there is no role of any kind of pharmacotherapy. Yes, anti-inflammatory only and only works when the patient finds plaques very early, means within days. Otherwise, there is no pharmacotherapy for Peyronie's. And surgery is never a good choice. Surgery is only and only choice if there is deviation of more than 90 degree. That is my clinical experience, and that I have discussed with a lot of urologists. That is my opinion. Thank you.
You have certain points where I would like to differ. The first is like if patient is having pain, that is not the time for surgical management. So we get patients where Peyronie is with pain. So that is the time for medical management. Second, irrespective of diabetes, patients who are not in the position to perform intercourse now, that is the indication for surgery. And at the time of the surgical treatment, along with the Peyronie's treatment, you can give a penile implant at that particular time, even in diabetics. Yeah, so.
No, but
We will be
But
wrapping up the
I
session.
agree with him because, okay, there will be recurrence of the plaque, but during that period, he will have the good sexual life. Means there is interval. He can enjoy sexual life during that period.
I'm sorry, we'll be wrapping
Yeah.
up the session now.
Yeah, it can be discussed during tea time. Huh?
I now call on stage Dr. Nagaraj sir to felicitate sir.